Welcome to Quantum University, Call for Action COVID-19. I am Dr. Paul Drouin, President and founder of Quantum University. And this call for action is addressed to all our students, our graduate, our quantum health coach. And it's also a very high interest for anybody that is concerned by the COVID-19. This call for action is like a commitment that has a Quantum University to support everything that is doing out there to counter this pandemic worldwide and nationwide. We're going through a very critical time. So everybody has to join together, support each other. And us at Quantum University, we can also help. And we will also introduce in this presentation Dr. Gerda Edwards, that is one of our eminent graduate. She is also a retired naval officer, 1979 to 2006, and we thanks her for her service in the military. Graduate student and PhD and Doctor of Natural Medicine, and also mentor for PhD. She has set up also a private telehealth practice in integrative health support for cancer. And she's also from Virginia. So let me talk a little bit about what is the object of this talk. There is many things that we can be doing aside of what is already all done. And we, again, reinforce all the directive that has been done by CDC, Department of Health, on this hygienes and distancing from each other, washing hands. You will have with this video the link that are complementing this presentation, where we are repeating again what are the necessary attitudes. So, and we don't do any claim about any products that can cure the coronavirus. It's not. It's more helping through the ability of our students, that some are already Doctor of Natural Medicine, Doctor of Integrative Medicine, Quantum Health Coach. We can all join and be able to support the people at home from the online tools that we are promoting at Quantum University. This is a critical time, and we all together, and of course, I have a high hope and faith that we will go to this event. And more we are joining, and there is also in this effort to distanciate and isolation that can be answered. Dr. Gerda Edwards will share with us how she had been offering volunteer service online to her community, and this is what we will discuss in this presentation. Next slide, please. So we already insisting and refer you to the previous video, how our students are trained in digital medicine, and today, of course, will emerge out of this crisis, blossoming of, first of all, school online that are offering degree and coaching course and so on. But what is the quality in Quantum University is we train already, we are training our students to do prevention, to connect with the client at home, supporting their health. So this is already out there, and I have spoken to this in the previous presentation. Next slide, please. So management, we are in a crisis now. We're talking more about emergency. There is a preventive aspect I will not cover. I covered this previously. Now it's like, what can we do? And this is what is this call for action. Because people are home now, they go hospital, they are scared. Some of them have tests, they can be reassured, some not because they're not sick enough. So how we occupy this time now we are at home, are listening news 24/7 and Netflix, but there is also an opportunity to be connecting with the coaching from home from a student that are qualified to mentor you to new habits and how you can enhance your immune system and how you can take care of your health. Next slide, please. So what will be done by Quantum University in the next weeks and months? We will honor this volunteer work that is, we'll talk about Dr. Edwards, Dr. Gerda, as 100 hours of volunteer work will be recognized as a practicum. And I remind you also that for the World Organization of Natural Medicine has a requirement of 40 hours of volunteer work. So I already discussed with the World Organization of Natural Medicine that any work that is being done either by a quantum coach, graduate student to support a client at home in this time of crisis will be recognized as hours for practicums or also hours for requirement for the World Organization of Natural Medicine. Let's come back to the studio. There is also another feature at Quantum University that when you sign up in the program, some students take advantage of what we call tuition award. Tuition award is not exactly free money. It's like convert in our volunteer work. And also, I remind you, if you have, done this previously, you have signed up in the school, these hours will account for what we call now a tuition award. And next month, we were doing special also to facilitate people to join our force online that can support the community. One very important factor in this crisis is the factor of fear and isolation. And I'll add to this presentation, you will have also a talk of Dr. Lipton talking about this phenomenon of fear that shuts down the immune system. So there is a way to look at this event as an opportunity to strengthen yourself, to communicate with others, to share your isolation, because you are not, there is other people that can also absolutely coach you from the comfort of your home to gather better habits. Next slide, please. So there is, of course, I already spoke, the digital medicine is a tool that can offer many of our students with a quantum health coach or their degree. Please, next slide. And here I come with something very simple, because supporting people at home, it's not that complicated. It's like you can, of course, use the advantage of digital health medicine, but most of the time it's just communicate with an individual that is not necessarily aware of all the potential of attitude that can be done at home. So I resume this by what I call the SENBM, lifestyle support. So the coach will have to insist, of quality of sleeping, exercise. You have to move every day. I heard this French guy that run his marathon on his balcony, but you don't need to go that far. But many exercises can be done at home. Yoga can be done at home. Stretching, jogging inside. So a little every day. And this is most of the time my philosophy. That I recommend to the student. You do a little study every day, and then one day you wake up and you have done all your program. And same time, to maintain your health is the same thing. I have this habit myself to do every time something every day. It doesn't need to be complicated. I post a few examples of my way to distance myself, hiking, kayaking, but not everybody has this opportunity. Many things can be done at home. The breath is learn what is the optimum breathing to generate heart rate variability. and the coach can help you with this. And meditation, we will have a special conference next week. You know, it's the time to learn how to meditate. How many people say, hey, I don't have time to meditate? Now in this context of quarantine, this is the best opportunity. And we have also offered a week ago a Nosphere, a worldwide meditation where thousands of people were joining us with this intention of healing. Next week, we're redesigning a guiding meditation that you can listen and with the art of breathing that, you know, if you don't, you can occupy your time with this exercise. Next slide, please. So just to refresh this, it's a repetition. You have to realize that meditation can take care of 87% less heart disease and illness, meaning immunity problem, cancer, Alzheimer. Please, next slide. So these simple things, you know, heart rate variability, how to breathe, how you calm down yourself, how you generate positive attitude toward this conflict that we are going through, this moment of fear. And so it's a very great investment. And we have students already complete some program that can help you, quantum health coach, PhD, and so on. So, and this art of breathing, you know, can help, you know, to reduce the cortisol level that is associated with stress, blood pressure, mood, physical stability, and so on. So let's come back to the studio. I think that was. So again, how can we take advantage of this event to be stronger? I said that in the previous presentation, you know, it's like, hey, now we're going to this crisis. The answer is management of this urgent reaction, which is totally unaffordable. You know, as it goes, we have to build new habits, you know, washing hands and so on, but also to strengthen yourself. And you will, and I ask, this call from the Quantum University to join, you know, students. You're already there. You have already this knowledge. You can already communicate with your circle in your community online, which is absolutely aligned with the recommendation of CDC. And this is what Dr. Gerda will explain. Next, is there another slide? Next one. Was it the last one? Okay, so I will not take more of your time. Dr. Gerda Edwards, that has this initiative will be a path to follow to be able to support other people, other client at home, not necessarily client. And then keep in mind what the assistance. No, I think there was a couple of other slides that we are not promoting products that cure, but we will have, of course, nutritional recommendation, some vitamin and supplement that you can take. Myself, you know, people ask me what I'm doing, you know, I talk about this homeopathics. Can you come with the picture now? One is the flu. This is look like a Coccinum. This is this is around now for 100 years. I don't know, can you, yes, this is it. So, and it's based on a formula that is used now to prevent flu. It's not, you don't want the virus get in. So how you build your immunity. And then there is another one called Defense. You will also have the link where to find these products, more documentation. They are part of the course. But again, this is not to cure. The recommendation that come, like the nutritional, the supplement, the vitamin, Dr. Gerda will come also with, you know, other recommendation is how can you get stronger to go through this crisis? So it's very important. So Dr. Gerda, that's your turn now. And please share with the whole world what you have done. It's in your community. This is absolutely enlightening. And I recommend everybody to follow her path. Thank you, Dr. Gerda Edwards.
Well, thank you very much, Dr. Paul, for having me today and sharing some of my work over the last few months. And we are stronger through community, most definitely, and that's coming to light in my community very quickly. And this is how I started. As a practitioner of integrative health specializing in cancer, I help people who are going through chemotherapy and also post-chemotherapy healing. But it's not always about the cancer patient. It's about the whole family unit. So I work with their family, and it's a program that's longer in duration. It's about 8 to 12 months. So I really get to know the family unit and how the whole family is healing, not just the individual. And I found lately that because of this, family members were calling me about the COVID-19 pandemic and what can they do. And then the extended family was calling me, and then friends of family was calling me. So I started seeing a pretty good need to educate and inform people on what they can do, at home and lifestyle wise. And then I was at a grocery store and I saw various people just arbitrarily buying supplements, and they didn't even really know what they were buying. They had just read something or listened to, a podcast, and then they were, buying a lot of supplements. And I realized, wow, there's dosing involved, there's contraindications, all of that. And so there was education needed there as well. And then more profoundly, I live in a housing development that where I have a profile on what's called nextdoor.com. And it's about the neighborhood, everybody who lives in the neighborhood. And our neighborhood is about 460 homes. And it's done by zip code. And on nextdoor.com, you can find out what the crime reports are. You can find out who's the best plumber in the neighborhood. All kinds of information. And I saw this post of a young family who both had lost their jobs, and they had a 4-year-old and a 2-year-old, and they needed diapers. They needed food. And a day went by and I saw that no one had responded. And so I responded and I said, I can help you. And so I just helped him with some grocery store gift cards and 3 boxes of diapers. And they were so appreciative. And boy, these 3 things really told me that there's a lot that we can do as not only doctors of natural medicine, but also doctors of humanitarian service, which is part of our board certification. People are scared of the unknown. At first it was about the virus, and now it's about not having work, being unemployed. It's about trying to make ends meet, and a lot of them feel absolutely hopeless. And people are fearful of not being able to also recover from any part of this, and they're simply just overwhelmed. They have a family, kids, grandparents, friends, all being affected by this. And so this is where we can really step in as students, as graduates, and especially as doctors of humanitarian service under the World Organization Natural Medicine. Nextdoor.com, which is nextdoor.com, is a great platform which provides online view of your neighborhood and connects you to the neighborhood. It really connects you to everyone. And this is where I posted my services as a DNM to anyone who needs help, needs advice, needs direction, at absolutely no cost. And, we can't solve everyone's concerns, but we can be there as coaches to help them prioritize, to pass information to them that they may not have seen about our community. We just went into a lockdown yesterday or the day before until June 5th. So that's going to have a profound effect on everyone. We can provide education on food choices, recipes to stretch our groceries, and we can help them calm anxiety. And as you said, we can influence and become that beacon of hope. Most of all, we can inspire other people in the neighborhood to help as well. Like I mentioned, I didn't see anyone respond to this family, but I'm also working on inspiring the neighborhood to reach out and help whoever can. And for those who are struggling, a 10-minute conversation with someone who is there to listen is worth its weight in gold. And so I've kind of started this next door, inspirational movement to not only reach out and help folks, but do things like um, getting people to post recipes that will stretch, buying a whole chicken maybe into 3 or 4 meals, for a family who can't readily afford a lot of groceries. So people are coming to task and posting, and I think getting really energized on helping our community. So that's essentially what I've been doing over the last month and a half.
And then, can you hear me, Dr. Edwards?
Yes.
And
Yes.
and and you're offering your services like a half day a week, 1 day a week. So how does it work?
Well, I started just half day a week, but now I take calls whenever I can during the week. If people cannot call in during that half day, I will take messages and I will call people back. So it's more a continuous thing now because of the severity of this pandemic that we're going into.
And of course, we will leave your website, and you agree also to help students or graduate that want to initiate the same action.
Absolutely. Nextdoor.com is national, from what I understand, and you just go to nextdoor.com, put in your zip code, and it will bring up your particular neighborhood.
So
and then you fill out your profile.
Thank you very much to share this. And then when I had the conversation with you, I heard about what you were doing. I find this very inspiring, because sometimes we say, what can we do? Or we feel very, without resource. But in some way, what you're offering is like the ground of the environment to create some calmness. And then, hey, we saying that you can talk to someone, being coach, is already a start of healing. And there's many hope out there. There's many news that we can see that we will go through this all together. The whole community blending at the same time. The feel of what we call integrative medicine or doctor natural medicine with the feel of medicine itself. So, and I think we can go to this crisis, and we have a role to play, which is now. It's like, hey, look at Dr. Gerda Edwards, what she's doing. This is a lot of help, and she does this in the respect of what we have to stay distant from one each other. But then at home, there is a lot that you can do, and the choosing the proper food. And I said again, the exercising and learn to meditate and breathing. And this is what we're communicating with the inside our curriculum of Quantum University. So I don't want to take too much of your time. Call for action. Next week, we will have another video trying again to help the community. We want Quantum University engage in this humanitarian help that is very important today. So thank you very much, Dr. Gerda Edwards, for the initiative. You are a beacon of light in this difficult time, and you are inspiring others to follow your path. Thank you very much.